Hi there, I'm Janessa. I'm going to be your nurse practitioner for today. Can I have you verify your name and date of birth?
My name's Lily Wilcom and my birthday is 8/2/05.
Alright, perfect. And who do you have with you here today?
This is my mom.
Hi, nice to meet you.
Nice to meet you guys. Alright, well, what seems to be bringing you into the hospital today?
Well, I've been having like a lot of diarrhea and it's been kind of watery. I've also been feeling really fatigued, like especially these past couple days.
Okay.
She's also had some blood when she goes to the bathroom and some pretty bad abdominal pains. We thought it was from her period cramps, but it just hasn't gone away.
Okay, well, we'll take a look then, alright? Do you have any family history of anything colon or rectal issues?
No, we don't have any family history of that.
Okay, sounds good. And Lily, have you had a fever or any weight loss recently?
Yeah, I think I've had a fever for at least a couple days now. And then I've also definitely lost a little bit of weight because I feel like I've just been like pooping out everything that I eat.
Okay. And can you tell me more about this cramping and abdominal pain, where it kind of is located?
It's like the left side of my stomach, kind of like lower, and it's like not like normal period cramps because it's like only that one side. It just feels a lot different. But I just feel like I'm in pain all the time and I'm just like so tired.
Okay.
And I've been documenting her fevers for the past couple of days, and it hasn't ever been lower than 100.6. And she really hasn't been drinking much. I'm getting worried that she might be dehydrated.
Okay. All right. And regarding when you use the bathroom, could you tell me what your stools are kind of looking like, and if there's a lot of blood, barely any blood in there?
I don't think I've had like a solid bowel movement in a while. It's been very watery with like blood too. And then also there's been this like mucus kind of like snot like stuff like that's come out in my like poop, but that looks like it should be coming out of my nose and not that.
All right. Well,
Okay.
these are all good things to be aware of. So I think right now we should just run a few tests and get a better idea of what we're looking at here, okay?
Okay, sounds good.
Perfect. All right, so I think we're gonna order some lab drawings. So what these drawings are gonna show us is your blood components, so like your red blood cells and white blood cells, making sure that those are looking healthy. We're gonna see your vitamin B12 levels and your iron levels, just to make sure you're not anemic or anything. We're also gonna take a look at your organ functions, which that's what the blood draw will also tell us. It will tell us if your liver and kidneys are functioning well, and it will also show us any inflammation or infection that your body may have. Does that sound okay?
Yeah.
Perfect.
So if she were to be anemic, it would just mean she has low iron, and iron is what carries the oxygen throughout her body, right?
Yep, that's
so
correct.
She would just have some low energy. That's
Yeah.
what it would mean?
Mm-hmm.
Okay, good to know.
And the next test that we would like to do is a barium enema, which is an x-ray that visualizes the colon and rectum, and it will identify any colorectal cancer, inflammatory bowel disease, or any obstruction in the colon. So for this test, we'll have you, Lily, lay on your side, and then we'll insert a soft tube coated with the barium sulfate into your rectum, and the barium will coat your intestine to show up on an x-ray to see if there's any problems that we need to follow up on.
Okay, just so we're clear, my daughter Lily, she'll be laying on her side while you guys stick a tube up her rectum that has a dye on it, and that'll give us a better look at her intestines.
Yep.
Okay. Is she gonna have any pain or side effects that we should know about? Also, is she gonna be sedated or anything, or is she awake for this procedure? And if she is there anything you can give her to maybe help her relax and have it not be so uncomfortable?
Yeah, there shouldn't really be any side effects, just more discomfort rather than pain. And we don't do any sedation for this procedure, but we can give her a muscle relaxant just to subside that cramping for a little bit while we do this. And then after the procedure or the x-ray, we will make sure that she drinks plenty of fluids just to make sure that we are flushing out any excess barium from this.
Does that make sense to you?
Yeah, that makes sense.
Okay.
Perfect.
Okay, hi, we're checking in because I have a follow-up appointment for some tests I had a few days ago. Can we go to our room? Thanks for taking us to our room. We're gonna wait now.
Knock, knock, knock. Hi there. I'm
Hi.
Janessa. I'm the nurse practitioner. It's good to see you guys again. So, can I have you verify your name and date of birth?
Lily Wilcom, 8205.
All right, and Mom, it's good to see you again.
Good to see you.
So, we are here regarding those lab works and that barium enema x-ray that we had. So, from your labs, it's showing that your results are a little low for your levels. Then they're lower than what we would like them to be at.
You said my levels were low.
Mhm.
So does that mean that like I have anemia, or like what does that mean?
As of right now, you do have anemia. Your levels are at about 9.5. Typically for women, we would like them to be above 12. But with the bleeding that you're having, it's not uncommon. We kind of expected you to be at a lower level. But as of right now, yes, but we can completely fix you up for it. So for the results of your x-ray, we have them up right here. So this is what the barium enema is showing. It basically is showing that you have a lead pipe appearance right here, which is something that we don't want to see. Typically, you'll have these ridges on your colon, which help move that stool and help you go to the bathroom. But what we're seeing is that you don't have these ridges, which is causing a problem. And so with this, we are believing that you have an inflammatory bowel disease called ulcerative colitis.
What?
Wow, I've never heard. So is ulcerative colitis curable, or does it put her at risk for anything else?
So ulcerative colitis is managed with different medications or with a colectomy, which is where they will remove part or all of the colon or
Wow.
rectum. And this just depends on the severity, so we obviously would need to kind of do a deeper dive to see what it's kind of like. But having ulcerative colitis puts you at a greater risk for developing cancer in the colon or the rectum. So it's a good thing that you did get this checked out so we can help figure out treatments and anything else that you guys may need.
So how did she get this exactly? Was it something I did, or was it something she ate? Like, we just don't understand how this happened to her.
No, so ulcerative colitis starts with inflammation of the rectum, and then it can go further into the colon. So in your case, Lily, it starts with this sore or an ulcer formed on the lining of your colon, which is why you're bleeding and have mucus in your stool.
That makes a lot like more sense, because I was so confused like about the mucus part.
Mm-hmm. So we don't know exactly what could have caused this, but some common causes of ulcerative colitis are the immune system, like an autoimmune disorder, so where your immune system mistakenly attacks your colon and rectum, or it can be environmental triggers like stress, smoking, or certain
Do you smoke?
medications.
Mom, I swear I don't.
Well, that's good, because then we know that that's not a cause of ulcerative colitis. But we would have to go more further into like a deeper dive on what caused ulcerative colitis for you. But for right now, we'll just focus on treatments and we'll discuss those options.
So with like having ulcerative colitis now, like how is this gonna affect like every day in my like daily life? Like what is that gonna look like?
So we'll start off with medications to help manage your condition, and we'll hope that this will be an effective form. But however, there are some cases where either symptoms can impact your daily life and they're just non-manageable, or the medications don't provide enough management, which is where we would have to do that colectomy or that surgery to remove part or all of the colon. So we'll first test out the medications and see how that goes, unless you want to do a colectomy right away, but that's not something that we recommend.
I don't think that's what we want to do.
I'm okay. I'll try the medications first. I don't
Okay.
really want to jump right to that.
Sounds good.
So with medications, she should be able to continue with her normal life, and it should be well managed.
Yep, with these medications, you will be able to live your normal life. There shouldn't be any complications, but we do ask that you keep up with your follow-up visits for the next couple months or years.
Okay, sounds
Okay.
good.
So Lily, do you kind of have an understanding of what we talked about today?
Yeah, I do have a pretty good understanding of everything that is kind of going on.
Okay, sounds good. And Mom, do you have a good understanding about the diagnosis and treatments?
So, just to be clear, she got ulcerative colitis because her colon became inflamed and it spread up her colon. And then an ulcer formed somewhere in there, and then that's what's causing her bleeding in the mucus. And then you said there were no specific reason why she got it, and it was just an environmental factor, autoimmune disease, or something like that.
Mm-hmm. And what about treatments? Do you remember what?
Yeah, it
we
can
talked
be
about?
managed by medications. She should live a pretty normal life with her medications if she keeps up with them and goes to her checkup appointments.
So what kind of like treatments will I get for like dealing with this like condition? Will I have to take medications? I know we kind of talked about that, but like how will those medications like affect my life? Because I know there's like side effects and all that.
Yeah, those are some good questions. I will have your nurse come speak to you guys about the different treatments and medications with you. So I will go grab her in a second for you. So thank you for your time, both of you, and I hope to see you both at your follow-up visits.
Okay, thank you so much.
You are welcome.
Hi, my name's Adriana. I'm going to be your nurse today. Can you tell me your name and date of birth, please?
My name's Lily Wilcom, 8205.
And who do you have with you today?
This is my mom.
Hi.
I'm Mom.
Nice to meet you guys. So, your nurse practitioner, Janessa, just assigned me to educate you on some lifestyle modifications and just the medications you're going to be taking to help with your ulcerative colitis.
Okay,
Alright, so first off, I'll just tell you a little bit about the lifestyle modifications that would be helpful for your new diagnosis. So first off, just during your flare-up symptoms, it'd be good to avoid foods that are high in fiber, like nuts, seeds, vegetables, and whole grains, because that can just irritate your colon. And then avoid dairy products, because that can just cause some more cramping. And then avoiding caffeine as well is something that would be good.
Really? So I can't probably drink coffee when this is like happening?
Yeah, because caffeine can just stimulate that GI motility, so it might make your diarrhea worse or just more discomfort.
So that means no.
Okay. And then just make sure you're drinking a lot of fluids if you are having diarrhea, just to help rehydrate yourself. And we just ask that you adhere to your medications, which I'll talk more about, but just stopping those immediately can just cause more adverse effects and just more flare-ups of your ulcerative colitis.
We'll stay on top of that.
Yeah, we will.
Alright, so I'm just going to talk about two medications that you're prescribed, and the first one is called sulfasalazine, and basically this is just used to help with mild to moderate ulcerative colitis, which is what you have, and also just kind of managing the symptoms. So basically what this medication does is it reduces that inflammation that you have in your intestine, and it takes about 2 to 4 weeks for the effects to start working. So you have to take it for a little bit.
Okay.
And we also just recommend that you take a folic acid supplement while you're on this medication, because it can just hinder the absorption of it normally. And then before you start the medication, we're just gonna check to see if you have an allergy to sulfonamide before you take it.
Okay, that sounds good. Sound good to your mom too?
Mm-hmm. Okay. Okay, so your next medication is called prednisone, and this is a type of glucocorticoid which also helps with that inflammation. And so you're using this when you're kind of flared up, which you are right now. And so you'll just need to come back for follow-up visits for this, because we'll probably start tapering down your levels of the drug. Since it is a steroid, you're not supposed to be on them for a really long time, just because of the side effects that come with that. And then once your symptoms improve, like I said, we'll start tapering down those dosages, because we don't want you to just abruptly stop the medication, because that can also cause more issues. And then just for both of the medications I talked about, just make sure you're storing it in a tightly closed container at room temperature, and also protect them from light and moisture, just to.
And then for the prednisone, she only uses that for flare-ups, right? Not.
Yes, but for now, we don't want you to just start taking it and then stop taking it once
Okay.
you get better. So we'll have you come back for follow-up visits while you're on this medication, and we'll taper you off as things start to get better.
Okay, that makes sense.
Yeah, that makes sense to me too.
Okay, perfect.
Oh boy, this sounds kind of like a lot to be into with. What are like the side effects of these medications that I have to take?
Yeah, so for sulfasalazine, the first medication I talked about, it can have some GI side effects like nausea, vomiting, or just some discomfort or loss of appetite. But if you take the medication with food or milk, that can just help not cause those GI side effects. And then for prednisone, this can cause high blood sugar, but we're gonna keep monitoring that while you come back for your follow-up visit.
And she's not a diabetic or anything, so
Yes, but sometimes people on steroids, if their blood sugar does get too high, we might give them insulin.
even
But
if she's not a diabetic?
Yes,
Wow.
but
Okay.
we'll keep you taken care of and we'll monitor.
Okay, good.
And it can cause an increase in appetite, which might cause a little bit of weight gain, and yeah, it can also cause low potassium levels. But like I said, we'll keep watching all that for you.
And
Okay.
that'll be in the follow-up visits, right?
Yes.
Yeah.
Okay, Lily, can you just repeat back to me what those side effects were?
Yeah, I can try. So for the sulfasalazine, you said it's gonna kind of cause some like GI issues, like nausea or vomiting, upset, loss of appetite, all of that kind of stuff, and like some discomfort. But if I take it with like milk, then that can kind of help like ease it and all of that. And then for prednisone, you said we're gonna like monitor. It can cause like hyperglycemia, so like high blood sugar, and then we're also gonna. It also could cause increased like appetite, so weight gain, as well as low potassium. So that's kind of stuff to look out for. But you said we'd like check up on all that when I come for my follow-up visits.
Yeah,
So
exactly.
I feel pretty comfortable with knowing those. Then that we're gonna monitor it.
Perfect, that's good.
So with these medications, are there any life-threatening effects or any potential threats? And if so, when would we need to call the doctor about these?
There are. So for sulfasalazine, you just want to call your provider if you do experience any nausea, vomiting, loss of appetite, rash, or headache. So a lot of them are kind of like the side effects, but also just that rash and headache. And then with higher doses of that drug, it can cause hemolytic anemia, inflammation of your liver, and then just a lower white blood cell count, which can affect your immune function.
What is hemolytic anemia?
So that's a great question. Hemolytic anemia is basically when your red blood cells are being destroyed faster than they can be produced.
Okay, that's good to know.
And then some adverse effects of prednisone could be, these are a little bit scary, but
Okay.
so they could be heart failure, GI bleeding or perforation, psychosis, seizures, diabetes, which we kind of talked about the increase in blood sugar, but we'll make sure that's all okay. And then serious infections, because long-term use of steroids can just decrease your immune function a little bit.
Mm-hmm.
And then, yeah, so if any of those occur, just make sure you call the provider right away and we'll get you some help. But just so you know, these occur with long-term use of steroids, and that is why we're having you come back, and so we can taper the dose down over time to avoid those consequences.
Yeah.
So it's very unlikely if we taper it down. And then just don't stop using prednisone abruptly even if you feel like your symptoms are gone, just because that can cause adverse effects. And that's why we're going to taper them down slowly.
Yeah, makes sense. Yeah.
Okay, so let me get this straight. For the first medication, I will contact the doctor if she has any adverse side effects like a rash or nausea and vomiting, or if she has a severe loss of appetite. Also, she can develop hemolytic anemia, which is just the red blood cells being destroyed faster than they can be reduced, correct?
Yeah, that's right.
Okay, and then for prednisone, some of the adverse side effects could be heart failure, GI bleeding, reduced immune function, high glucose, but that's kind of more in diabetics, which we already touched on a little bit. Those will be checked on in our follow-up visits, and a majority of these happen in long-term use because they are steroids. So something important to remember is to not stop taking them abruptly, right? Just because these adverse effects could happen as well.
Mhm.
Okay.
Alright, so Lily, do you understand all the side effects and what to do moving forward?
Yeah, I think so. So if I experience kind of any like itching, rash, allergic like reaction kind of type, bad headache, or like seizures or heart failure, that's kind of like combination. I know both the medications, then I'll definitely like call the doctor right away. I will also try to avoid foods like high in fiber, dairy, spicy foods, and caffeine, and to make sure to stick to my medication plan. And if I know that I'm lacking, my mom will definitely keep me in check.
Don't have to worry about that.
Okay.
Yeah.
Well, good. Sounds like you both have a good understanding of everything. So
Yeah.
if you have any more questions, just call a provider. And is there anything else I can do for you today?
No, we're
No, I don't
good.
think so.
Okay. Well, thank you for your time, and Lily, I hope everything goes well for you.
Yes, thank you so much.